So everyone take like a rubber band and help the other person. You're going to wrap it around someone's finger. You're going to turn it a few times like that. Or you can do it yourself. Take your finger, wrap the rubber band around. And then when there's 100% function, we have ease in the body. It's easy to remember things. It's easy to digest food. It's easy to fall asleep. It's easy to wake up in the morning with energy that you need. It's easy to digest your food. So that's when we're all healthy. Now, who wants to tell me, if you left this rubber band on for like a week or two, what's going to happen to your finger? You didn't do it, did you? Okay, those who did it, are you feeling anything different? Yeah? What?
I don't know what it is. I haven't felt, it's not long enough.
Okay, it's not long enough, but there's just a tightness from the rubber band? Yeah. Okay. And do you think it might change colors? Anyone's changing colors? Nice. And does it feel any different? Numbness or tingling or throbbing? So, eventually what will happen to this finger if you leave it on? It'll die. Exactly. Why is that?
Because it's not getting blood.
Won't get blood. Exactly. So that's the term stagnation. And this can happen anywhere in the body. Anyone heard of a stroke before? What is it?
It's like your brain isn't getting enough blood.
Yeah, a particular part of your brain, the vessel is blocked. So the nerves in the brain in that area don't work. They die. And then maybe you're like this, or you can't speak, whatever. It's a real example. How about, what would happen if this was the supply of blood to your heart? What would happen to your heart over time? This was the heart, and this is the blood going to it. Shout out. Heart attack. That's what a heart attack is when the blood vessels are all blocked up. You don't get blood to the heart muscle, so it doesn't have any energy. So that's what stagnation is. This is a very real thing that happens in people's body. And you can take the rubber band off, unless you have it. Okay, so very quickly.
And we do that again in the theme of communication, because it's a good way to demonstrate with patients exactly what stagnation is and what can happen to the body if stagnation is not dealt with. So if stagnation is not dealt with, it's left there and it blocks oxygen, nutrients, hormones, or all of the above. The body's function starts to decline. So at 80% function, it's like a B minus. Well, maybe, no, not here, I don't know. Great deflation. Okay, so at 80% function, that's when we start to see malfunction or dysfunction. Does that make sense? Okay, and if the stagnation is not removed and there continues to be a blockage in the flow of blood and nutrients, then the body will continue to decline. And so at 60% function, that's when we start to see dis-ease or disease. Right? And if the body still continues to go into decline and the stagnation is not dealt with at 40% function, that's when we start to see symptoms. So does that surprise anybody? I always ask patients if it surprises them, because we would like to think that symptoms would start to appear like right around here to let us know right before it actually declines to such low function. So that's why we talked a little bit about some symptoms, especially symptoms of stress as health students. I'm sure some of you occasionally have some stress. And so if you're seeing symptoms as a result of that, or from any other cause, then actually your body has already undergone quite a bit of degeneration there. So, yes?
A question about chi.
Mm-hmm.
When you say it carries oxygen, like, can you explain that?
Yeah.
Chi is actually energy and oxygen together. And the Chinese character for qi is a character that represents steam pushing a lid off of a boiling pan. It's just like that. It's that energy of this expansive, and so it goes in the lungs. So qi animates the lungs, and that's what oxygen is. So it's energy and oxygen together. So it's actually the blood carries the oxygen, and the energy moves the blood. That's what Esther said. But yeah, not necessarily. Anyway, that's. Did that answer your question? Yeah. All right. Any questions on this part?
When you say like at 40% you see symptoms, but like what do you mean by that? Wouldn't you see symptoms when you have malfunctions?
Not necessarily. It depends on the system in your body. All the systems have to get to a certain point of degeneration before the body actually shows symptoms. So let's think about diabetes. Anyone know anything about diabetes? Anyone know anyone who has diabetes? Yeah? Okay. Now, what are some of the advanced symptoms of diabetes?
They're really tired.
Like what?
They're really tired all the time.
Tired? Yeah, it could be. Yeah.
No blood sugar?
Low blood sugar, that's early.
Oh,
Yeah. I'm talking about symptoms. Low blood sugar is actually a sign. It's something that's measured. It's not like a symptom. A symptom is something that we subjectively feel. Good answer though. I mean, that's definitely part of it. And you could be tired. Tired is definitely a symptom. But it's, yeah.
Also blindness and like loss of limbs.
Exactly. Blindness and what?
Loss of limbs sometimes. Like
Loss of
sometimes
limbs.
you have to, like,
Exactly. That's exactly right. Yeah, it's because the nerves die and you get neuropathy and numbness, tingling, and then you can't feel anything, and then you get gangrene. Then you have to have a cutoff. Exactly. And that's because stagnation. Things not flowing right. So those particular symptoms of diabetes show up after it's really progressed. Those are really severe symptoms. But usually people don't have symptoms of diabetes. Maybe they feel a little like hypoglycemic, their blood sugar drops a little, but they don't necessarily know that it's diabetes. How about cancer? How many people have cancer? Not here. But how many people in general have cancer and don't know it? You think it's possible that someone could have cancer and not have symptoms and still it's really progressed? Is that possible? Yeah. That's what we're talking about here. So this actually fits, but you aren't going to learn this in medical school. They are not going to teach you this paradigm, but this is the real paradigm. And so, again, language of healing. So, I know that we're probably out of time.
Yeah.
So thank you so much for inviting us. Hopefully you learned a little something. We didn't overwhelm you with too much information. At least the nurturers. If you want to hug later, we'll give you a hug. The nurturers. Right, any questions? Yeah.
What's the red card?
The red card.
When you're going through the
Yeah.
cards?
So the red card is action for them. The people who are really action oriented, they want the executive summary. They don't want a lot of knowledge. I mean, they don't need all the details. They just say, just cut to the chase. Do I do this, or what? They want, is that it?
Yeah. What about the blue one?
And the blue one is the blueprint type. And the blueprint type of person is one who really follows the rules, like processes, and is very strict and follows the rules, and that makes them feel comfortable and stable. It makes, each of these is a particular behavioral style. And so, like if they are, yeah.
I'm sorry, but we have,
You need this room now.
yeah, we do.
Okay, we're finished.
Very cool. Thank you.
All right. Thank you again.
Thank you.
And we do, at the office, we can offer anyone a free stress and toxicity evaluation because you were in this class. Just call us and let us know. And we will also call a person who has the free half-hour massage. It might be 2 or 3 people.